Hi, my name is Rosemary Becchi, and I'm running for Congress in the 11th District of New Jersey. And I'm joined today with my good friend, Dr. Bill Cassidy, who is also a United States Senator. We're here today to talk about how to keep your family safe and to learn more about the virus itself. You know, as leaders, it's important for us to protect our citizens. So as a result, we're going to put this important information on our website, beckyforcongress.com, as well as on Facebook. Senator Cassidy is a medical doctor. He is also a former teacher at LSU. He also founded a clinic that helped provide health care for the working uninsured. And today he serves in the United States Senate. So thank you, Dr. Cassidy, and thank you for being here today and answering the questions and concerns that are on the minds of New Jersey families.
Hey, thank you, Rosemary. I also in my practice did a lot of public health, did immunization programs, vaccinating children against hepatitis, for example, measles, mumps, rubella, and all that immunology of public health. So I'll use that as I reference some, if you will, FAQs on this current epidemic. First, some people want to know, what is a virus? Think of it as a germ. In this case, it's spread by breathing, maybe through other means, principally breathing, principally through spit, a lot like the flu, a lot like the flu. Secondly, people say, then how is it different than the flu? 10,000 people die a year from the flu. Why is this so much different? Well, as it turns out, as long as you have been alive, you have been exposed to the flu every year, either by a vaccine or actually having the flu. You may have had the flu and not realized it. Your symptoms were so moderate. But nonetheless, your immune system has been exposed to the flu, in my case, 63 years. 63 different times I've been exposed. So my immune system has this library. And so if I get a new flu virus that comes into my body, initially, either because I've been vaccinated or because I've been exposed or both, it has a whole book of immunologic response. And as that virus comes in, my immune system grabs it and brings it down. If you've ever watched The Matrix and those kind of metallic monsters like spiders that try and break into the whatever they call where Neo is, and into the spaceship, if you will, and they hit the button and they all die, that's what your immune system does to that flu virus, because that is how our bodies have been trained to react. What is different about coronavirus, in the 3 million history of mankind, the 3 million years of history of mankind, as best we know, our bodies have never, ever been exposed to this strain of coronavirus. In 3 million years, we've never had exposure, which means the library is empty. There is no response. And there's nothing to pull out to say, oh, this is how we address it. So that coronavirus is a sucker punch to our immune system. Just, ooh, we're not used to it. That's why it has been so deadly. Now, as it turns out, the younger you are, typically, not the first year of life, but the younger you are, the fewer the symptoms. You can have symptoms, but the fewer the symptoms. You may be infected and be totally asymptomatic, meaning that you have no symptoms whatsoever, but you still have the ability to infect other people. Out of China, there's a report of a 20-year-old woman visited her family. They all ended up in the hospital. She never had symptoms, but they knew she was the one who brought the infection to the family. Now, every decade of life after age 20, after the 20s, you tend to have more complications until you get to those 85 and above. And if they go to the hospital, they have a 15% mortality rate, a 15% death rate for those who are 80 and above. 70 and above, not as high, but still very high, going down to where you start having a significant uptick around age 50. That is particularly true if you have hypertension, if you have diabetes, or if you have an immunocompromise of some state, of some reason, cancer, for example, a poorly treated HIV. All those things would place you at increased risk of having a complication from an infection. Now, what can we do about it? What can we do about it? My gosh, we're in this together. We are in this together. And right now, there is not yet, although there's some reports of some drugs, there's not yet a generally accepted effective therapy for those who have the virus. So you go to the hospital, the doctors and nurses will give you oxygen, they'll put you in the bed, they'll give you IV fluids if you need them, but as yet, we don't yet have a proven treatment or cure for the virus, except if you do not infect another person. Think about it. The way the virus currently works, somebody who's infected infects 2 to 3 other people. And those 2 to 3 other people infect 2 to 3 more, and those 2 to 3 more infect 2 to 3 more, and it keeps on going. That's why when you have one case, very quickly it shoots up like a rocket ship. That's what's happened in Italy. It's what's happening in my state of Louisiana. The way to prevent that from happening is not to infect another person. So if you perhaps are infected and you make the decision to stay at home for 14 days, at which point the virus will be cleared, then you don't infect 2 to 3 other people, and those 2 to 3 do not infect 2 to 3 other people, on, you have saved more lives than the doctors and the nurses in the ICU are capable of saving. You, me, us can save more lives if we just decide to follow the president's instructions, your governor's instructions, etc., to self-quarantine. Now, you may say, I don't have any symptoms whatsoever. Yeah, but right now they're still asking people to stay at home. As I mentioned before, you can be infected but not have symptoms. And you may think you're okay, and you go and give your grandmother a kiss on the cheek. You spread the virus to her, and she dies. Just to put a point on it. And everybody asks me, well, how bad will this be? And when will it stop? My return question is, how effectively do we socially distance? How effectively do we quarantine if we think we've been exposed? If we do not do it, it's going to be like Italy, where we go up like that, and lots of people die, not just because they have the virus, but because the healthcare system is overwhelmed. I should point out, some are dying in Italy, not because they have the coronavirus, but because they're in a car wreck, but when they bring them to the hospital, the beds are all full because of coronavirus. And they die of the car wreck because there is no bed for them to be cared for. So you also crowd out treatment for conditions that ordinarily you would be able to someone would be able to recover from. So, on the other hand, if we flatten the curve, if we socially distance, then instead of having a huge peak, we'll be more like South Korea, where they had an initial outbreak, but then they quickly flattened the curve. The healthcare system was not overwhelmed, and people were able to return to their normal life. That's our goal. That's our goal. That's our goal. Now, Rosemary asked me to speak as well as to what's happening in Congress. Congress will do whatever is needed to get the American people through this rough spot. We started off with a pretty good economy, a real good economy. We've hit this rough spot. We need to preserve so that when we come out of it, the economy is strong once more. How do we preserve? Making sure that folks have a little bit of money in their savings, because emergencies will still arise even in the midst of this emergency. Secondly, we want to make sure that small businesses are cared for. Small businesses have the ability to continue to keep their employees employed, so that when the rough patch is over, everybody's in position to continue going. And lastly, for the big businesses that employ so many folks, also measures for them. Folks say, well, why are you worried about big business? Because big business employs a lot of people. And you don't want big business going out of business and those folks left unemployed. This is about the employees, not about the business. Let's take care of the employees, but to do so, you can take care of the employer, and you do two things at once. Rosemary, I'll just finish by saying this. Some folks may say, wait a second, Congress has not done what everything they need to yet. I'll say, then Congress will do more. We're committed to making sure this happens. By the way, I think Rosemary is particularly suited to help address this, because we need different solutions that don't just rely entirely upon the federal government, but bring in the private sector, bring in the individuals that have great ideas, that can actually take what the government is doing, but then make it so much better. If we rely entirely upon the government, that isn't going to work. But if we can have that partnership where we are all in it together, which Rosemary's background uniquely positions her to be able to see how to do, then we will come through this and we will be stronger yet. And that's the goal. So welcome to answer any questions.
Thank you, Senator Cassidy. So Congress has now passed 2 stimulus packages. What will be the focus of this next stimulus package?
Well, I'm not sure I'm calling it a stimulus. I'm calling it more, if you will, of, I don't know what I'm calling it, but I'm calling it phase 3 right now.
Phase 3.
It's going to be health of individuals in society. It's going to be the individual, the financial health, not the physical, not only the physical, but also the financial health of the individual and the family. And then we're also going to try and take care of the small businesses that employ the individual. And we figure that kind of multi-phase response. We have to get some money to communities. If you're reliant upon sales tax and all of a sudden everything is shut down, then you need to be able to support them. By the way, there's some who say, why is this a bailout? I draw a contrast between this and 2008. Some folks objected to 2008, feeling like some activities were improper, almost criminal. The federal government has told you to shut down your business. If the federal government tells you to shut down your business, it's not your fault you're going bankrupt. And so I think this is an entirely different situation.
Right. No, I agree. I mean, this is a liquidity problem, a moment, a leap in time, and a liquidity problem. So we've gotten a lot of questions from New Jersey families, so I'd love to read you a couple of those questions and have you answer it. The first one is, we've started to hear about many treatments to help people with the coronavirus. How far away do you believe we might be from finding a treatment?
First, let me say, God bless all the doctors around the world and all the scientists around the world finding solutions. And folks that have been hit first have given lessons that are benefiting us. And so in China, for example, they've done studies with a drug called chloroquine, a drug that's been around for a long, long time. And they have found that on certain patients, if you give it, it can shorten the course and maybe help people return to health. Australia has done drugs with another one, I think it's Remdesivir or something like that. I have it written down, but it's got a bunch of M's. So suffice it to say, this is a drug that was fashioned for Ebola, but now seems to potentially also help when it comes to coronavirus or COVID-19. So there's at least 2 candidate therapies out there that may benefit. There's also other therapies that aren't drugs per se, but that may help neutralize the virus. So that said, there are therapies coming down. It's not just the United States working on it. When I say we're all in it, we are all in it around the world. And that which is being learned in Asia is helping people in the United States, which is helping people in Italy or the rest of Europe.
Okay, and our next question is, what steps would you suggest small business owners follow who find themselves in difficult financial situations?
So great question, great question. The Treasury Department will be putting out, has already put out, and allowing people to file their taxes late. Their April 15th filings can be late, number one. Number two, Republicans have proposed that there would be a Small Business Administration loan program that would be very easily accessed, that would be there for the small business owner, and the portion that she or he uses to keep people employed would have ultimately be forgiven, and that which is used for other reasons would be a low-interest, long-term loan. So as long as you can, try and keep people on board. That will poise you for success when this rough patch ends. Help your employee, of course, and the federal government is there to help you make ends meet in the meantime.
Okay, another question that we've gotten is coronavirus seems to have hit our seniors the hardest. What ideas do you have to help seniors acquire groceries, medicines, and other necessities to stay out of crowded stores?
Yeah, what a great question. A couple things. First, as regards your doctor visits. What Congress has done, and as a physician, I immediately started proposing this, hearing from my medical providers, and this has been implemented, to allow advanced use of telehealth. And so now if you need to see your physician, say for example you're on chemotherapy, whether you're an older person or not, you can now use your iPhone to communicate with your doctor and to tell your doctor, listen, this is how I'm feeling. He says or she says, okay, don't come in, you stay right there, and I'm going to send home health to come see you. We're expanding the use of home health. Before you had to come in, the doctor had to sign forms. Now the doctor will be able to order it to come out and visit you, even without you coming in. And they'll be able to leave equipment there for you to use. So, for example, a pulse oximeter, which measures the oxygen in your blood and your pulse, something to measure your blood pressure. The doctor can monitor you through telehealth, and you never have to come in. Specifically regarding groceries, there will be dollars for social agencies to help social agencies do more Meals on Wheels, if you will. In my own state, we're working with faith-based organizations. If you think about that 20-year-old who's home from college, she's kind of bored, but she cares about our community. She could go shopping for somebody, bring and drop off those groceries, and the person, after she leaves, could come and take those groceries in, kind of wipe them down, put them up, and she would have the groceries, the person who's homebound, without ever leaving the door. And clearly there's other services like Peapod, for example, or Amazon, that can or your local grocery store that can deliver. CVS, Walgreens, other pharmacies are now delivering drugs as well. So I think our society is responding in a variety of ways to help people be able to stay at home, but still stay at home.
Well, if you have time for one more
Yes.
question, another question is, what will be the criteria our government uses to begin lifting the quarantines and the curfews?
Great question, Rosemary. I can tell you come from a consultant background because this is exactly, if we're going to restore the balance between physical health and economic health, then we have to figure out when people are physically healthy. If you don't mind, I'm going to speak a little bit like a doctor. When 40% of, if this is your whole population, when 40% of the population is immune to the coronavirus, it's harder for the coronavirus to spread. We spoke earlier about when one person is infected, they infect 2 to 3 other people, who infect 2 to 3 other people, who infect 2 to 3 more. When 40% of the population is infected, epidemiologically, it's harder to infect 2 to 3 more people. You only can infect one person on average. And that's when your rate of spread begins to decrease. That's what we want, the rate of spread beginning to decrease. So if we get to the point where 40% of the population has naturally been exposed and has that built-in immunity, we can begin to restore normality. My own advocacy is that we begin broad testing of who might have already been infected, didn't know it, but is now immune. And those who are not immune, you would check them again in a month and a month. Until you understand that 40 or 50% of your population has been exposed, those people can begin to return the economy to normalcy. It is thought, not proven, but thought in the summertime, the coronavirus does less well in heat and humidity. I'm from Louisiana, I love that concept. But it does less well, so there may be a tail off, but we really want to have some recovery before then. And if there's broad spread immunity before then we hope that we can begin to recover normalcy, hopefully have a vaccine, so that if we need to vaccinate people in a year, we can. So we don't have to rely upon getting infected, it can be the vaccine. But the first step is knowing that 40% of the people are immune.
Well, thank you, Senator Cassidy, and thank you for joining us today and really providing this really important information to New Jersey families.
And can I say one more thing?
Sure.
I thank you for running for Congress. If there's a time when we need a new way of approaching, a way that works across the aisle, I mentioned we're all in it together. We're all in it together, not just on this, but on many programs. And if you have somebody who's going to actually work across the aisle, bring ideas about partnerships between the private sector, between the government sector, between individuals, to something that benefits us all, that's the kind of candidate you need. So, Rosemary, I hope to have you as a colleague, and I hope that the people of New Jersey see the wisdom in electing you as such.
And thank you, Senator Cassidy, for joining us today. Really appreciate you providing this really important information to New Jersey families. And thank you all for joining us. We will put this very important information up on our website at beckyforcongress.com as well as on our Facebook page. I wish you and your family all the best and be safe. Thank you.